Hello there, I'm Dr. David Thompson, a 60-year-old cardiologist and internist here in the United States. After more than 3 decades of caring for patients over the age of 50, I've learned something important. A lot of people think blood pressure is just a number, and as long as it's under 140 over 90, they're in the clear. But the truth, it's not that simple. The Framingham Heart Study shows that your risk for heart disease starts to climb at just 115 over 75 millimeters of mercury, and every 20 millimeters of mercury increase in systolic blood pressure nearly doubles your risk of a heart attack or stroke. If you have diabetes or high cholesterol, the danger zone can start as low as 125 over 80. High blood pressure isn't like falling off a cliff at 140/90. It's more like sliding down a slippery slope without realizing it. I think of Robert, a 58-year-old patient of mine. Healthy-looking guy, active, came in one day with a reading of 128 over 82. He smiled and said, "I'm good, right, doc?" But when I looked at his history, mild diabetes, high cholesterol, and a family history of early stroke, I knew this wasn't good. This was a warning sign. Just a little complacency could have pushed him into real trouble. The key is this: we treat people, not just numbers. A blood pressure of 125 over 80 in a young athlete is very different from that same number in a 65-year-old smoker with diabetes. That's why blood pressure goals have to be personalized, especially for people at higher risk. Sometimes that means aiming for as low as 125 over 75 to protect the heart, brain, and kidneys. I've also met plenty of people who bring home a blood pressure monitor, get different readings than in the clinic, and assume the machine's broken. Most of the time, it's not the machine, it's how you're measuring. Maybe you just walked up the stairs, had a cup of coffee, or felt anxious when you sat down in the doctor's office. All of those can push your numbers up. To get a reliable reading, you've got to measure at the right time, in the right position, and give yourself a moment to relax first. And let's be clear, low blood pressure isn't always bad. If your reading is 90 over 60 and you feel fine, no dizziness, no fatigue, that may be perfectly normal for you. But if you're feeling weak, lightheaded, or faint, it's time to figure out why. If you want to keep your heart healthy, start small. Check your blood pressure regularly and write it down so you can track trends, cut back on salt, stay active, get enough sleep, and manage stress. Medication is the last step. Only after lifestyle changes aren't enough. Blood pressure tells the story of how you live and care for yourself. And the best part? You can rewrite that story, starting today. You know, one of the questions I hear most often is, "Doc, why is my blood pressure at home so different from when I'm in the clinic?" The truth is, blood pressure is like a small bird. If you want to catch it, you have to be gentle, patient, and do it the right way. One small mistake, and that number flies off. I remember Linda, a 67-year-old patient. In the clinic, her blood pressure was 145 over 90. At home, it was 130 over 82. She thought, "My home machine must be broken." Not at all. At the clinic, she'd just driven 30 minutes, searched for parking, rushed inside. Her heart rate was already up. At home, she was sitting calmly, breathing steadily, and that reading reflected her true state much better. So how do you measure blood pressure the right way? First, pick a time when you're calm and have been resting for at least 5 minutes. Don't check it right after climbing the stairs, finishing a meal, or drinking coffee. Sit in a chair with your back supported, both feet flat on the floor, and your arm at heart level. The cuff should go directly on your skin, not over your clothing. While you're measuring, don't talk, don't fidget. I often tell my patients, pretend you're watching a sunset, nothing to do but breathe. When the reading is done, write it down along with the date and time. I recommend taking 2 readings, 1 to 2 minutes apart, then averaging them. And if you can, check at the same times every day, say, in the morning after you wake up and in the evening before bed. Remember, one reading doesn't tell the whole story. We need an entire blood pressure diary to understand the real trend. It's like watching a movie. You can't judge it from a single scene. One last thing, the monitor is just a tool. Its real value comes from how you use it and how you interpret those numbers in the context of your overall health. Measure correctly, keep good records, and bring them to your doctor. That's one of the best gifts you can give your heart. I like to start this part with something I often tell my patients. Medication can save you, but lifestyle is what keeps you healthy for the long run. After years in medicine, I've learned this. The human body has a remarkable ability to heal itself if we give it the right conditions. And when it comes to blood pressure, that's especially true. I think of James, a 63-year-old patient whose blood pressure was 142/88. His previous doctor was ready to start him on medication. But James said, "Doc, give me 3 months to fix this on my own." I agreed, but only if he followed my instructions to the letter. First, cut the salt. Most people think just using less salt while cooking is enough, but the real culprits are hidden salts in processed foods, canned soup, packaged snacks, bread, even breakfast cereal. We swap those out for fresh foods and natural seasonings like lemon, pepper, and garlic. Next, regular physical activity. No need to run marathons. For people over 50, I usually recommend a brisk 30-minute walk daily, or swimming, or light cycling. Not only does it lower blood pressure, it also improves sleep and mood. Then, sleep. I've seen many patients drop their blood pressure by 5 to 10 millimeters of mercury just by getting 7 to 8 hours of good rest each night. Sleep allows your body to shut off stress signals, relax your blood vessels, and naturally lower your pressure. Finally, manage stress. I taught James to spend 5 minutes each morning breathing slowly and deeply, and to make time for activities he enjoyed. Gardening, listening to jazz. Long-term stress is like leaving a car engine running all night. It's bound to burn out sooner or later. 3 months later, James's blood pressure was down to 128/80. No medication needed. More importantly, he felt healthier and more energized than he had in years. Here's what I want you to remember. Lowering your blood pressure naturally isn't a quick trick. It's a way of life. You don't have to change everything at once, but each small step, less salt, more walking, better sleep, mindful breathing, is a brick in the foundation of a strong, healthy heart for years to come. One thing that worries me most about high blood pressure is how silent it is. It doesn't shout, doesn't warn, doesn't make you feel pain right away. It's like a slow leak inside your home's walls. You don't notice it until the damage is already done. Many people tell me, "But doc, I feel perfectly fine. How can my blood pressure be dangerous?" That's the most dangerous illusion. You don't have to feel dizzy, have headaches, or be short of breath to be at risk. Sometimes, though, your body does send signals. You just have to listen. Think of these as gentle knocks on the door. Morning headaches, especially at the back of the head. Occasional blurred vision, like looking through a thin fog. Feeling unusually tired after small tasks. Numbness or weakness in an arm or leg, even for just a few minutes. Trouble focusing or noticeable memory lapses. I remember Karen, a 70-year-old patient. She often had mild morning headaches but assumed it was from sleeping wrong. She never checked her blood pressure at home. When she finally came in, it was 158/92, and an ultrasound showed her brain's blood vessels had already begun to stiffen. She had no idea she'd been living with high blood pressure for years. It's like driving a car with worn-out brakes. You can keep going for a while, but the moment you need to stop suddenly, it might be too late. I want you to remember this. High blood pressure doesn't just harm your heart. It can slowly damage your eyes, your brain, and your kidneys. That's why doctors call it the silent killer. So if you're over 50, think of checking your blood pressure regularly the same way you think about brushing your teeth. Not because you're sick, but because you want to keep things healthy. And if you notice any of the warning signs we talked about earlier, don't ignore them. They could be the alarm bell that gives you time to act. I want to end our conversation today with an image I think you'll carry with you. Imagine your heart as a lifelong companion, one that's been with you every step of the way, beating steadily since the day you were born. And now at 50, 60, or beyond, that companion is a little more sensitive to what you eat, how you sleep, and the stress you carry. Blood pressure isn't just a number. It's the language your heart uses to say, "I'm okay," or "I'm struggling." The beauty is, you can listen to that language every single day with just a few minutes and a small home monitor. I know changing your lifestyle isn't easy. Cutting back on salt, exercising regularly, sleeping enough, managing stress. It sounds simple, but it can be a real battle against old habits. Still, I've seen plenty of people, even in their 70s and 80s, make those changes. And the reward is more healthy, active, energetic years of life. Remember, you don't need to be perfect. You just need to be better than yesterday. Every meal with less salt is a win. Every walk instead of sitting in front of the TV is progress. Every night you get 7 hours of sleep is a gift to your heart. If today you start by taking your blood pressure and writing it down, you've already done more than you think. And if you share this video with a friend or family member, you might be the reason they avoid a heart attack or a stroke. Your heart has taken care of you your whole life. Now it's time to take care of it. And I believe that starting today, you'll do it better than ever. I'll see you in the next video, where I'll share tips to keep your heart healthy and happy at any age. Until then, remember, every heartbeat is a gift, and stable blood pressure is how you keep that gift for longer. Before we say goodbye, I'll leave you with this question. Have you ever wondered, does the number I see on my blood pressure monitor truly reflect my health? In my clinic, I've had people say, "Doc, at home my blood pressure is fine, but the moment I walk into the hospital, it shoots up." Or the opposite, "It's high at home, but normal when I'm here." The truth is, your blood pressure can change within minutes because of posture, stress, or even just the way your doctor looks at you. Yes, that's a real thing. That's why some people have white coat hypertension or masked hypertension without knowing it. In the next video, I'll walk you through how to measure your blood pressure with 100% accuracy, from arm position to timing to recording your results so your doctor can make the most informed decisions. I'll also explain why some people take dozens of readings and still don't know they're in the danger zone. If you've made it this far, I know you care about your heart. And trust me, the next part will help you turn your home monitor into your most powerful tool for protecting your health. So if you haven't subscribed yet, do it now and turn on the notifications so you'll be the first to know when that video's up. Because health doesn't wait. I'll see you next time.